And we are going to be talking about drugs for peptic ulcer today. So it's your girl Amarachi, and welcome back to my YouTube channel. So for today, we're going to talk about drugs for peptic ulcer, and there are just 3 things I need you to have in mind. Because you know that for ulcer, the pathologist, the gastric acid is one eroding the mucosa which will now create an ulcer. And we all know that the infamous bacteria that causes ulcer is H. pylori, Helicobacter pylori. So now we're going to, because of this pathology, is going to help us to understand the classification. So just like the thumbnail, we're going to be having what? The gastric acid secretion inhibitors. So we're going to have secretion inhibitors. Then we're also going to have gastric acid neutralizers. And we're also going to have ulcer protectives. So, and then for the infamous bacteria, we're going to have what? Antibiotics for H. pylori. Okay, so we reiterate again. We say we have gastric acid secretion inhibitors. So it's just like a war. In a war, we can either inhibit the war, that's your government to inhibit and make sure the war does not happen, or if they send a bomb, they have to neutralize that bomb and they have to protect the citizens. So just the same thing, we're going to be having secretion inhibitors, we're going to be having gastric acid neutralizers, and we're going to have ulcer protectives, and then antibiotics. Then you can see that the gastric acid secretion inhibitors is further divided into 4, and the mnemonic for these 4, I used to call them AP, just like an app to inhibit. So we say AAPP, an app. So now the first A is going to be anticholinergic, and then the second A is going to be antihistamines. So for the antihistamine, I know the reason why I said is the second A, to remind you that it's what? H2 receptors. So H2. Then the other P is what? Proton pump inhibitors. That's the PPIs. The proton pump inhibitors. Then the other P is prostaglandin analog. And the analog we have here is usually E1 analog. E1 analogs. Okay, so I'll go ahead to list the drugs. Then we have anticholinergic, antihistamine, proton pump inhibitors, and we have prostaglandin analog, the app. Now, for the anticholinergic, I want you to, if you remember our anticholinergic series, remember pop, just like a pop, it pops. Okay. Now, the antihistamine, you have to take note of the INE, because you know pharmacology, you could also use the endings to know how the name of the drug will sound. We're going to use INE in this case. And then for the proton pump inhibitors, I want you to remember we are going to use ROPE. So the mnemonic is going to be ROPE. ROPE for what? PPIs. And then for the prostaglandin analog, E1, there's a reason why I said E1, because E1 is going to be what? Misoprostol. That's mono misoprostol. If it was E2, dinoprostol. Okay, got it. So we're going to be having just one drug here, which is what? Misoprostol. And remember, is a giveaway, so we don't need to do much. Now for the pop, the first P is pyranzepine. The second P is the second P here is propantheline. And propantheline always sounds to me like go and tell him. So propantheline, okay? And then the O is oxyphenonium. And you can also see this drug in our anticholinergic series. Now we go to the other H2, and in the H2 we have the INS, okay? The CFR INS, that's what I call them. Cimetidine, ranitidine, and famotidine. So the ins. So we have the ins, which is cimetidine, ranitidine, and famotidine. Then for the PPIs, which I said is rope, we're going to remember rabeprazole, omeprazole, pantoprazole, and esomeprazole. So rabeprazole, omeprazole, pantoprazole, and esomeprazole. So now, always remember that if for every drug classification, at least know 2 drugs in a class. If you're not able to get the whole rope, you can get rabeprazole and omeprazole, and then you can now later fit in your mind pantoprazole and esomeprazole. And one thing I always say is we'll watch these videos several times and practice at least a drug class every morning, and you're going to get this classification. So we're going to get what? Rabeprazole, omeprazole, pantoprazole, and esomeprazole. So that is that for the gastric acid secretion inhibitors. Then we'll go to the gastric acid neutralizers. And for the neutralizers, they are further divided into 2 again. Further divided into 2, which are what? The systemic and non-systemic. And for the systemic, I always do this thing where I say systemic is sodium, non-systemic is magnesium. I always try and have it in mind like that. So in sodium, we have sodium bicarbonate and sodium citrate. Sodium bicarbonate, sodium citrate. Okay. And then for the non-systemic, we have magnesium hydroxide and magnesium trisilicate and magaldrate. So that is that for the neutralizers. Just remember, neutralizers are divided into 2, systemic and non-systemic, sodium and magnesium. Sodium, we have sodium bicarbonate, sodium citrate. For the non-systemic, we have magnesium hydroxide, magnesium trisilicate, and magaldrate. And then we now have ulcer protectives. For the ulcer protectives, I always say we have CBS. Okay, CBS, which is colloidal bismuth subcitrate. Colloidal bismuth subcitrate. And the other S, remember, there is what? Sucralfate. Sucralfate. And then the other we have antibiotics. And the antibiotics, I always say, use MAT protocol or TAM protocol. MAT, where we have metronidazole, amoxicillin, and tinidazole. So this is it for drugs for peptic ulcer. So we reiterate again, we say there are 4 classes we need to know in this drug. We have the inhibitors that inhibit, we have the neutralizers that neutralize, and we have the what? Protectives, and also for the what? Bacteria. And for the inhibitors, we say we have anticholinergic, that's the AP, anticholinergic, antihistamine, PPIs, and prostaglandin analog. So for the anticholinergic, we say we have POP, pyrazepine, oxyphenone, and propantheline. For the antihistamine, we have CFR or CRF. Okay, and we have the ends with din, cimetidine, ranitidine, famotidine, the ends because of histamine. Okay, and then we now come to the PPIs, that's the proton pump inhibitors, where we say we have a rope. So inhibit, we have a rope. We have rabeprazole, omeprazole, pantoprazole, esomeprazole. And then we'll now come to the prostaglandin analog E1, where we say we have what? Misoprostol, because it's E1, we have mono for misoprostol. If it was E2, it would be dinoprostol. And then we'll now come to the word systemic and the non-systemic. And said that is for the gastric acid neutralizers. The neutralizers work systemic and the ones that work non-systemic. And for the systemic, we have sodium. For the non-systemic, we have what? Magnesium. For sodium, we have sodium bicarbonate, sodium citrate. For the non-systemic, we have magnesium hydroxide, magnesium trisilicate, and magaldrate. So we'll now come to the what? The protectives, because we have to protect the CBS, colloidal bismuth subcitrate, okay? And then we'll have the sucralfate. Okay, and they will now come to the antibiotics, and I say we can use the MAT protocol where we have metronidazole, amoxicillin, and tinidazole. And I also want to let you know that the gastric acid neutralizers are also known as what? The antacids. So this is where we have the what? The antacids. Okay, this is it for the drugs for peptic ulcer. And remember, this is just one video out of the whole video where I have mnemonics for all the classification of pharmacology drugs to make your pharmacology very easy and very smooth. If you've reached the end of this video, please remember to subscribe, like, and share so I can reach to my 1000 viewership or 1000 subscribers. That is my aim. Okay, thank you very much for watching. See you in the next video.